understanding and preventing substance abuse related problems with special reference to alcohol abuse that we're going to focus on. And my name is Jeff van der Westhuizen. So that's what's going to happen here. This is the topic: to empower our people to have a healthier workplace environment. So what's going to happen in these 6 episodes is that I've got 2 objectives that I would like to achieve. And first of all is to provide you with the necessary knowledge and practical tools to address and prevent substance abuse problems, and then in particular alcohol. So that's what we're going to do. And the second thing that I would like to see happening is that we're going to address the underlying issues contributing to alcohol abuse, such as, for instance, a lack of proper stimulation, socio-economical factors that play a role, and then also family-related problems that we're going to address during these 6 episodes. But today, first episode, we're going to focus on the contributing factors towards alcohol and substance abuse. In other words, why are people doing it? The reasons. And then in the next episode, in the following Tuesdays, today we are focusing on a first episode, which is on Thursday, and from episode 2 to 6, we're going to focus then on Tuesday afternoons, where we're going to do this presentation. So next episode, we're going to focus then in particular on the telltale signs of alcohol and substance abuse, and I would also like to work then on a profile of alcoholism and how does such a person look like. And then in episode 3, we're going to work on the role of line managers in addressing alcohol and substance abuse related problems in the workplace. Episode 4, what we're going to do there is the practical guidelines to support an employee who abuses alcohol or any other related substance. Episode 5, then we're going to work more on understanding the roots of alcohol abuse and addiction. There we're going to dive really into the emotional unmet needs, etc., the roots of the pain points, in other words, that we're going to focus there on. And then finally, we're going to work on the preventative alcohol abuse strategies in the workplace, but also in the community as such. So this is what we're going to look at episode 1, namely the contributing factors. Let's look at today the first episode on the contributing factors that play a role in alcohol abuse and substance abuse. And I think we need to first look at the broader picture. What's going on here in South Africa? You know, South Africa is a very complex country. It's a complex relationship that we have with alcohol, shaped by historical, cultural and social factors, and we can't really ignore it if you look at the history. And so this complex relationship that I'm mentioning here is deeply rooted in our history, in our country, marked by colonialism and apartheid and socio-economic disparities. Why am I saying it? Because we've got some of the highest figures of alcohol abuse in the world. So it's abnormal how it goes here in South Africa. So let me just elaborate more. If you look at the broader picture, the historical context, like during colonial times, alcohol was used as a tool of control, and notably in the DOP system in the Western Cape, like with the farmers. I remember as a kid, I witnessed this system still happening there in the Western Cape, and the devastating consequences of that we still see, especially in the Western Cape, where the alcohol abuse figures is just astronomically high in comparison to all the other provinces in South Africa. So Now, that system, for instance, perpetuated the cycle of dependency and social control, and embedding alcohol consumption into the fabric of certain communities. And also, if you look broader here in the other provinces, like the legacy of apartheid further exacerbated these issues, like this shebeen system that we get, where disappropriately located in black townships, we saw it, fostering environments where alcohol abuse became prevalent. And so these historical injustices have left lasting scars on our communities and normalizing the heavy drinking problem in many, many segments of our society. So that's the problem, the mindset of South Africans, that we just think it's okay, it's normal. And currently, alcohol plays a significant role in social rituals in many communities and celebrations across South Africa's diverse communities that we see. And from traditional ceremonies then to urban nightlife, and drinking is often seen as a means of social bonding and expression. We've normalized it. And however, this cultural acceptance that we sometimes see masks the darker side of alcohol consumption, including like the rates of alcoholism and the link with domestic violence, gender-based violence, and in particular road accidents in South Africa. And socially speaking, the pressures of poverty and unemployment and the remnants of systemic discrimination can really drive individuals towards alcohol as a coping mechanism. And that's what we see in South Africa. So while there's an ongoing effort to address these issues through policy and public health campaigns, I tell you the challenge still remains to change this landscape in South Africa. And we have a lot of work still to do in terms of going forward. And if you look at the heavy drinking statistics in South Africa, like the third of our population who are drinkers engage in heavy alcohol consumption, and we think it's normal. And South Africa ranks 5th globally in terms of per capita alcohol consumption. So 5th global, just think about that. And we have the highest per capita alcohol consumption in Africa, with an average of about 11 liters per person. We are a drinking nation, I tell you. And this is really affecting our country in a huge matter, costing our country billions of rands, and also having a devastating impact in the workplace environment. We sit with a certain mindset that needs to be challenged, in other words. And this is going to be a heavy challenge for us to adjust this mindset. If you look at the mining towns in South Africa, especially in northwest, and if we look the northern province also, a dusting mining town, what's happening? This is just the way of living. Everybody's just drinking. And to address that mindset, we need to do more. There's lots of work that needs to be done. But I think what we need to understand first, before we can address this problem in the workplace, in our communities, we need to understand why are people doing that. And if we understand the whys, then we can go into the depth of saying, right, now we're going to address the problem effectively. And let me tell you, the problem doesn't lie in getting more rehabilitation centers. We're doing an awesome job, but we are just dealing with the consequences. In the communities, you guys there in the communities need to do something about it. And it's time that we need to take hands with regards to this preventative programs to work on the mindset of the community. And that's a big challenge. So let's have a look at the factors that play a role. And first of all, what I want to do, I want to let us explore the psychological factors that play a massive role in alcohol consumption and abuse, and then also then other substances. First of all, if we look at the first psychological factor, this has got to do with coping mechanism of our people. Because we drink so much, we don't have proper coping mechanisms to deal with stress, to deal with conflict problems. Many people use alcohol to cope with stress and anxiety, depression, and even trauma. We are a traumatized nation because of the extremely high crime statistics. And what alcohol does is just a temporary relief that people will get from numbing their emotions, and that provides just that feeling of feeling okay, forgetting about my problem. And now it creates a vicious cycle where that person will just rely on drinking to manage their negative, unpleasant, undesirable emotions. So as a coping mechanism, what were we doing it? We are basically numbing the pain instead of knowing how to address the pain that we are suffering from, especially with regards to not being able to cope. So we see it so many times when people can't cope, when they go into distress, that's when alcohol becomes a shortcut. Distress, the difference between stress and distress is very important to understand. We all experience stress. Stress can be a good thing. It can be a motivator. But when a person goes into a state of distress, you are being overwhelmed. It's too much to handle. And when that happens, we have lower distress tolerance levels, and what then happens, people resort to these shortcuts, in this case then substance abuse. The second part of psychological factors that we need to understand is mental health disorders. And I just want to tell you, this is quite shocking, but I'm picking up more and more of people reporting problems with alcohol abuse. Alcohol has become the secondary problem. The primary problem is mental health disorders. And people are using alcohol to deal with their mental health issues. More and more we see that alcohol rehabilitation centers can't really deal with these patients who are being admitted there because of the dual diagnosis. Dual diagnosis means the person has got an addiction problem plus the person has a mental health problem, like conditions such as depression, bipolar disorder, eating disorders, and then also I want to mention here personality disorders such as borderline personality disorders, where substance abuse among those people are very, very, very high. And then also PTSD, post-traumatic stress disorders. These conditions are often linked to a higher rates of alcohol abuse. So now when we have to deal with that problem, we can't just help the person to stop drinking because the person's got a mental health problem. We have to address that issue as well. And then what happens with these mentioned conditions, alcohol is now just not a matter of a socializer, it's become medicine. So people self-medicate these symptoms related to these conditions, and despite exacerbating these conditions, on the long run they just carry on doing it because the underlying condition still remains. And we can also look at the social and the cultural factors that play a massive role in alcohol and substance abuse problems. Like the first one is peer pressure and social influence that play a role. And we see in many cultures, for instance, that drinking is a social activity, for instance. And peer pressure there plays a big role in the African condition. When the men drink beer, it's a social thing. All the guys are drinking beer, and the pressure there is enormous. So when in the rehabilitation centers, what we have to focus a lot on these profiles of patients to help them with skills of setting boundaries and how to assert oneself in such a context when you are being pressured to participate in that drinking activity. And that's peer pressure. Especially during our adolescence and early adulthood, we see this condition. Also among students, we see this. And this can lead people to drink excessively in order to fit in or to be accepted by their peers. We see that kind of situation also occurring. So, as I just said, that when it's a peer pressure issue, the rehabilitation program focused in a lot on how to handle and ground yourself assertively, and we use a lot of role play activities to help and empower people to stand firm during situations and scenarios of social pressures. And along with peer pressure and social influences, what we also get is cultural norms that we get, and the media influence. And we know over the years that our government has really clamped down on advertisements. So government is really doing a wonderful job in terms of curbing these advertisements, but yet the rate of alcohol abuse still remains very, very high because of the embedded social norms, and also that social media still portray of alcohol use, to normalize excessive drinking in a community, because everybody is doing it in a small mining town, for instance, and this is what everybody is doing, so I will also participate. I just heard now before I started that a person there from one of your towns there in the Northern Cape, he was transferred here from my city towards your side. He never drank, but now over the weekend he works so hard, 6-7 days a week, and then the only thing he does, he goes to that well-known name of that venue there in your town that I'm not allowed to say, but that's his only outlet. So he started to drink excessively, and his wife stays here in Pretoria, and she's very concerned about what's happening there on your side. And this is got to do with the cultural norms and media influences that can also play a massive role there. Then we have a certain group of people who abuse substances and alcohol who's got a genetic predisposition. This we see in particular if it's been running in the genetic line, in the family tree. Parents have been abusing substances, alcohol, and grandparents also. Then we may suspect if that person perhaps has a genetic predisposition. And research indicates that genetics does play a significant role in the risk of developing alcohol use disorder. But what's amazing, although it's the case, we can still educate and equip and empower that person to rehabilitate. And so that's the good news. So people with a family history of alcohol abuse, they are more likely to struggle with the same issue. And when we see a patient with a chronic condition of alcohol abuse, and in the next session I will talk about the profile, but one of the profiles of alcoholism is then the chronic user. And then we have to take drastic measures. We need to have medical intervention, and that's where the implant and anti-booze and all of these medical aids will also be applicable, that the doctor and the psychiatrist have to consider when it comes to genetic predisposition, because these people keep on relapsing the whole time. Apart from genetic predisposition, we also have to understand that sometimes there are biological factors that also play a role, and some people just have a tendency towards dependency, and we can't deny that. We have to look at it, that some people's predisposition is just that the way their brain has been wired, it just happens that they have a tendency to abuse alcohol in excessive amounts. And it's got to do with the brain chemistry, the brain function, how the neurons fire, and especially with regards to the dopamine levels. That's your pleasure reward system. If your dopamine levels are not firing the way it should be, and then when such a person uses alcohol, and alcohol then works on the dopamine receptors, and what then happens, it triggers that part of the brain, the pleasure reward system of the brain, and then they don't stop, then they can't stop until they either pass out, or there's no money, or they get dragged away, or get arrested by the police, whatever. And biological factors can really affect how people experience pleasure and reward. And then when they get intoxicated, that pleasure, the brain stores that pleasure memory in the brain, and this becomes the person's idea of pleasure. Every time when I drink, it makes me feel so good. It gives me the reward. And so these kind of patients, then they become more susceptible to become addicted to alcohol. Then also there are environmental factors. I'll get to personal factors very soon, but let's first have a look at environmental factors that play a role, such as stressful life events and major life challenges, or even traumatic events such as the loss of a loved one, the loss of a job, can trigger alcohol abuse. Or what about job insecurity? We know in the mining sector currently there's a lot of rumors going on, and the rumors sometimes result into the reality of people losing their jobs, and just the mere thought of that uncertainty that people face and the consequences of being retrenched causes many people to drink more than usual. Or even after a person has been laid off, these kind of trigger events can cause a person then to resort to alcohol just to numb or escape from reality, and in consequence what then happens, just making the problem even worse. So that's stressful life events. Then we also get, along with the social norms of acceptability, is accessibility, and how alcohol is just so freely available in our country. If you look here up in Northern Africa to the Arab countries, it's almost impossible to obtain alcohol, and the alcohol abuse figures there is almost zero in those countries if you look at the figures. But because it's so freely available and accessible, what happens, it can easily contribute to this problem that we have. And by law, alcohol is not a legal substance. We must understand it's a controlled substance. Just keep that in mind. But despite that fact that alcohol is a controlled substance, that doesn't deter people from stopping doing it. The same now also with cannabis, with dacha. It's now legal to use it in your own home, but the accessibility is going to also cause more problems in the future. And because of the accessibility and availability, the mindset is it's okay. If it's available, it's okay. If everybody's doing it, it's okay. Then I can also do it. So that's in the environment that we are in, play a massive role. And as I said earlier, if I am sitting in an environment like let's move over to the personal factors, like that if I sit in an environment of boredom, and then people can easily resort to alcohol to fill a void in their lives, and whether it be boredom or loneliness, that can also play a massive role. So then drinking actually becomes a way to pass time, or just to feel for that moment better and to be connected in that environment where we are now, just even if it's just temporary. But another personal factor that I would like to highlight has got to do with low self-esteem and confidence. So these things we need to address as well, the low self-esteem and confidence. And people with a very low self-esteem, or those who lack confidence, may use alcohol to feel more sociable and outgoing. And what they do, they mask their insecurities. And thus it enhances social interactions. And I've never seen and met a person with an alcohol addiction problem who's got a good self-esteem. Alcohol, as we know, removes many things. It's a good stain remover, but it also removes our confidence. It strips us from our confidence, because as we numb it, as we mask, what happens? The real authentic you is not visible anymore. You start having these two identities, and the alcohol, the substance abuse identity, eventually overshadows the authentic you. And part of our programs in rehabilitation in South Africa is to help the individual to reconnect with themselves, because they've been so disconnected, lacking self-awareness. And that is one of the most important tools that we use in rehabilitation, namely to reconnect with yourself. And I don't want to go into detail about the tools that we use for reconnection or with myself and to enhance self-awareness. That is what we do inside of the clinics where we work, and there are amazing tools available. But yet, I think from a societal point of view, we also need to work on and identify how people to build their self-esteem, especially when we work with the youth of South Africa. They need to learn to have good self-confidence, learn to stand up for yourself, learn how to manage pressure, learn to set boundaries by saying no. So these are the personal factors that play a massive role in our lives. I think for today I would like to only just conclude with the reasons why people are abusing alcohol or any other substances. And just in summary, I just would like to say that understanding the reasons behind alcohol and other substances abuse is crucial for developing effective prevention and treatment strategies in your town and in your community. It's important to recognize that alcohol abuse is not a one-size-fits-all issue or approach. Each person's relationship with alcohol is influenced by a very unique combination of all the mentioned factors today. And by addressing the root causes, and this is what I intend to focus on in the following follow-up sessions, whether these root causes are psychological, social, genetic, or environmental, or a combination of it. Then we can better support those struggling with substance abuse and help them on the path to recovery, because there is really hope for everybody who's suffering from alcohol abuse and substance abuse. Now, in my opinion, addressing the substance abuse requires a compassionate and a very comprehensive approach. And now you get already an idea what I'm saying, that we're not going to use a punitive approach anymore. That's the old school, the old days when we used to have a punitive approach. Some countries like Thailand, for instance, also have a punitive approach. They send a person to jail, but it's a special kind of correction facility where the person is also being punished for their addiction problem. And we try to decriminalize our treatment to help the person in a non-judgmental way. And this means that in terms of the sessions that lies ahead, it's about providing support systems, mental health resources to understand the pain behind the person suffering from this addiction, and that if we don't treat it as a criminal offense from our side, yes, let the police do their work, let the criminal justice system do their work if crimes have been committed, but eventually, ultimately, it's about helping people to be rehabilitated, helping individuals to make healthier choices, and finally, ultimately, to find alternative coping mechanisms. Now, I'm looking forward to my next episode, where we're going to look more on the profile, and we're going to explore the profile there of a person who abuses alcohol and other substances. I would like to go more into detail about other substances, because very often people who abuse alcohol are also abusing other substances like painkillers and other self-medication that is available. So thank you so much for this wonderful opportunity today that I was able to share with you, and I'm really looking forward to the next time. That will be next Tuesday at 4:30 in the afternoon. Thank you so much.